Hello friends. Today we are going to perform a breast implant surgery on a 25-year-old patient who is 1.72 centimeters tall and weighs 59 kilograms. Before the surgery, we simulated which implant to use. For this simulation, I used sample models of our implants. Our patient wanted it to be under 350 cc. We tried 350 cc. She found it a bit small and decided on 375 cc. I think this is the right decision. So why do you want to have this surgery? What problems are you experiencing?
I have self-confidence issues. Low-cut clothes don't suit me, and because of my job, I also do modeling.
Do you also have difficulties wearing swimsuits or evening dresses?
Yes, a bikini was never possible for me.
So how did you decide?
Time was passing, but my breasts weren't growing, so I said I must do it now.
I think you made the right decision. It will look great. This is not a difficult surgery. It's a procedure I frequently perform. We will place the implant under the muscle. It won't prevent you from breastfeeding or giving birth in the future. Our patient is very determined and knows what she wants. She first thought about 350 cc but found it a little small, then decided on 375 cc. Her chest wall is a bit wide, so we considered that a larger implant could make her look overweight. 375 cc is definitely the right choice. We will use a round implant. I don't expect any problems. The result will be very beautiful. Thank you. Hello friends. We are performing a breast implant surgery on our 25-year-old patient. Her chest is quite firm, and her muscles are very strong. We decided on a 375 cc round implant. I have now created the pocket for the implant, and I'm about to place it. I'm using a funnel, which allows us to insert the implant much more easily, without it touching anything. As you can see, it fits comfortably. Yes, lift it up, that's enough. Alright friends, our patient has very strong muscles. She wanted a slightly larger implant. Although she is tall, her chest structure is quite tight. We placed the implant, and it looks very good. Now I'll place the other side. I opened just enough space for the implant to fit, not a wide or excessive pocket, because that could cause other problems later. I'm placing the other implant now. As you see, it's a round implant, placed under the muscle. We also add some solution inside to help it slide through the channel easily. I'm using a special solution, including antibiotics, so the implant goes in more comfortably and safely. In the past, we didn't have this technique. Now it's a big advantage for both us and our patients. I'm placing this side now as well. The implant is actually quite large, but the patient insisted on having a fuller and bigger look. It wouldn't be right for us to force our own choice. Patients usually want fullness, and she will have a very beautiful result. When placing the implant, it must be centered properly, not too high or too low, not too far inside or outside. This is very important. At first, because of the pressure of the muscle, the implant will look a little flat. Over time, it will reach the desired projection. That's why patients need to be patient during the healing process. After surgery, patients often say, "Doctor, it's not as big as I expected," or they're worrying it might get smaller. But in fact, it's the opposite. As the implant settles into the pocket, it achieves a much nicer projection and shape. So, breast implant surgery should not be thought of like a quick salon service. It requires a settling period. And during that time, the breast takes its final shape. Yes, I've placed the implants and they look very good. I believe our patient will be very happy. It has taken about 20 minutes so far. Now I'm closing the stitches, and the surgery is finished. Thank you.
Tick, tick.